Question 1. The analysis reveals that during the process of taking an impression for a dental restoration using alginate material, a patient exhibits a pronounced gag reflex, making it difficult to complete the procedure comfortably and accurately. The dental anesthesia assistant DAA is tasked with assisting the dentist. What is the most appropriate course of action for the DAA in this situation, considering patient well-being and the need for a diagnostic impression? Option A. Administer a mild sedative to the patient to suppress the gag reflex, assuming this is within the DAA's authority. Option B. Immediately stop the impression process and inform the patient that it cannot be completed due to their gag reflex, without exploring any further options. Option C. Attempt to manage the patient's gag reflex through communication and reassurance, and if unsuccessful, consult with the dentist for alternative strategies before abandoning the procedure. Option D. Proceed with taking the impression as quickly as possible, despite the patient's gagging, to minimize the duration of discomfort. The correct answer is C. Attempt to manage the patient's gag reflex through communication and reassurance, and if unsuccessful, consult with the dentist for alternative strategies before abandoning the procedure. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between patient comfort and the need for accurate diagnostic information, directly impacting the quality of care a dental anesthesia assistant DAA can provide. The DAA must balance the patient's immediate discomfort with the long-term implications of a poorly fitting restoration due to an inaccurate impression. This requires careful judgment, prioritizing patient well-being while upholding professional standards. Correct approach analysis. The correct approach prioritizes patient comfort and safety by addressing the gag reflex before proceeding with the impression. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. From a regulatory standpoint, dental professionals are expected to provide care within their scope of practice and to a standard that ensures patient safety and comfort. A DAA's role includes assisting the dentist in managing patient anxiety and discomfort, which extends to facilitating procedures that are as comfortable as possible. By attempting to manage the gag reflex, the DAA is acting within their supportive role to ensure the procedure can be completed effectively and with minimal distress to the patient, thereby upholding the standard of care. Incorrect approaches analysis. One incorrect approach involves proceeding with the impression despite the patient's severe gag reflex without attempting any mitigation. This demonstrates a failure to uphold the principle of non-maleficence, as it risks causing significant distress and potential injury, e.g., gagging leading to aspiration. Ethically, it prioritizes procedural completion over patient well-being. Regulationally, it could be seen as a failure to provide care to an acceptable standard, potentially leading to a complaint. Another incorrect approach is to immediately abandon the impression procedure and inform the patient that it cannot be done, without exploring any management strategies for the gag reflex. While patient comfort is paramount, a DAA's role is to assist in finding solutions. This approach fails to demonstrate professional initiative and problem-solving within the scope of assisting the dentist. It could be considered a failure to adequately support the dental team in achieving the diagnostic goals. A third incorrect approach might involve administering an excessive or inappropriate sedative to manage the gag reflex without proper assessment or authorization, exceeding the DAA's scope of practice and potentially endangering the patient. This would be a direct violation of regulatory guidelines regarding medication administration and scope of practice, as well as a breach of ethical duty to act within one's competence and to avoid harm. Professional reasoning. When faced with a patient experiencing a gag reflex during impression taking, a DAA should first attempt non-pharmacological interventions such as distraction, reassurance, or suggesting a different impression technique if appropriate and within their scope to suggest. If these are insufficient, they should communicate with the dentist to discuss further management options, which might include topical anesthetics or other strategies. The decision-making process should always involve a risk-benefit analysis, prioritizing patient safety and comfort while striving to obtain the necessary diagnostic information for effective treatment. Question 2. The evaluation methodology shows a dental anesthesia assistant DAA is preparing to administer local anesthesia for a dental procedure. The patient expresses significant anxiety and discomfort when the DAA begins to explain the injection site, specifically mentioning a fear related to the appearance and perceived function of the palatine tonsil area. The DAA knows this area is adjacent to the target nerve for the planned block anesthesia, and that understanding its typical location and function is important for the patient's comprehension and to alleviate fear. What is the most appropriate course of action for the DAA in this situation? Option A. Immediately stop the explanation and inform the patient that the procedure will be modified to avoid any contact with the palatine tonsil area, without further explanation. Option B. Advise the patient to research the palatine tonsil area online to better understand its anatomy before proceeding with the explanation of the injection site. Option C. Tell the patient not to worry and that the palatine tonsil area is not relevant to the injection, proceeding with the explanation of the injection site without addressing the patient's specific concern. Option D. Gently explain the general function of the oral cavity's soft tissues and how the palatine tonsil area, while sensitive, is typically located, and why understanding its proximity is helpful for the patient to feel more at ease about the procedure. The correct answer is D. Gently explain the general function of the oral cavity's soft tissues and how the palatine tonsil area, while sensitive, is typically located, and why understanding its proximity is helpful for the patient to feel more at ease about the procedure. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire and the dental anesthesia assistant's DAA professional responsibility to ensure patient safety and optimal treatment outcomes. The DAA must navigate the patient's discomfort with a specific anatomical structure in the oral cavity, which is crucial for the planned anesthesia procedure, while upholding ethical obligations and adhering to the regulatory framework governing dental anesthesia assistants. The core of the challenge lies in balancing patient autonomy with the DAA's duty of care and the need for accurate anatomical understanding for safe practice. The correct approach involves a thorough, patient-centered explanation of the anatomical structure's function and its necessity for the planned procedure, coupled with a collaborative effort to manage the patient's anxiety. This aligns with best professional practice by prioritizing patient education, informed consent, and a therapeutic relationship. Regulatory guidelines for DAAs emphasize the importance of clear communication, patient comfort, and the assistant's role in supporting the dentist's treatment plan. By explaining the function of the oral structure, e.g., the pterygomandibular space for inferior alveolar nerve blocks, and its critical role in achieving adequate anesthesia, the DAA empowers the patient with knowledge, thereby reducing fear and fostering trust. This approach respects patient autonomy while ensuring the procedure can be performed safely and effectively, adhering to the DAA's scope of practice and ethical responsibilities. An incorrect approach that involves dismissing the patient's concerns or proceeding with the procedure without adequate explanation would be professionally unacceptable. This would constitute a failure to uphold the ethical principle of beneficence, acting in the patient's best interest, and potentially violate regulations requiring informed consent and patient communication. Ignoring the patient's expressed discomfort and anatomical apprehension demonstrates a lack of empathy and a disregard for the patient's psychological well-being, which can negatively impact the patient's overall experience and trust in the dental team. Another incorrect approach would be to immediately suggest altering the planned procedure without first attempting to educate the patient and address their concerns. This could lead to suboptimal treatment, unnecessary complications, or increased costs for the patient, and it bypasses the DAA's role in supporting the dentist's established treatment plan. It fails to leverage the DAA's knowledge to overcome patient apprehension through understanding. A third incorrect approach might involve the DAA attempting to provide medical advice or reassurance beyond their scope of practice, such as making definitive statements about the absence of pain or the complete safety of the procedure, without the dentist's direct involvement or assessment. This could lead to misinterpretations, false expectations, and potential liability. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and acknowledge the patient's concerns. Second, assess the validity and nature of the patient's apprehension, considering the specific oral anatomical structure in question and its relevance to the planned procedure. Third, consult with the supervising dentist to ensure alignment on the treatment plan and communication strategy. Fourth, provide clear, concise, and accurate information about the relevant oral anatomy, its function, and its importance for the procedure, using language the patient can understand. Fifth, collaboratively explore strategies to manage patient anxiety, such as relaxation techniques or further reassurance from the dentist. Finally, document the patient's concerns and the interventions taken. Question 3. The performance metrics show a consistent pattern of patient anxiety during dental procedures, and during a recent appointment, a patient exhibiting signs of hypoglycemia, sweating, confusion, shakiness, was noted. The supervising dentist is currently engaged in a complex surgical procedure in another operatory, with limited immediate availability. As the dental anesthesia assistant DAA, what is the most appropriate immediate action to manage this hypoglycemic event? Option A. Administer an intravenous dextrose solution without direct confirmation from the supervising dentist, assuming it is the most effective treatment. Option B. Wait for the supervising dentist to complete their current surgical procedure before assessing and treating the patient's symptoms. Option C. Advise the patient to drink a sugary beverage from the waiting room vending machine without further intervention. Option D. Immediately administer oral glucose gel or a glucagon injection, as per the clinic's emergency protocol and under the dentist's general supervision, while simultaneously attempting to contact the dentist for specific instructions. The correct answer is D. Immediately administer oral glucose gel or a glucagon injection, as per the clinic's emergency protocol and under the dentist's general supervision, while simultaneously attempting to contact the dentist for specific instructions. Explanation: this scenario presents a professional challenge due to the immediate need to address a potentially life-threatening hypoglycemic event while adhering to established protocols and maintaining patient safety. The dental anesthesia assistant DAA must balance swift action with the requirement to operate within their scope of practice and under the supervision of the licensed dentist. The ethical imperative is to act in the patient's best interest, which includes preventing harm and providing appropriate care. The correct approach represents best professional practice because it prioritizes patient safety and follows established emergency protocols. Administering oral glucose or glucagon, as per the dentist's direction and the clinic's emergency protocol, directly addresses the physiological cause of hypoglycemia. This action is within the DAA's scope of practice when supervised by a dentist and aligns with guidelines for managing medical emergencies in a dental setting. It demonstrates responsible decision-making by acting decisively and appropriately within the established framework. An incorrect approach involving delaying treatment until the dentist is fully disengaged from another procedure would be a significant regulatory and ethical failure. This delay could lead to worsening hypoglycemia, potentially causing seizures, coma, or permanent neurological damage, violating the DAA's duty to prevent harm. Another incorrect approach, such as administering a medication not specifically indicated for hypoglycemia or not authorized by the supervising dentist, would constitute practicing outside the scope of practice and could lead to adverse drug reactions or ineffective treatment, also violating professional standards and potentially specific state dental board regulations. A third incorrect approach, such as solely relying on the patient to self-administer glucose without direct supervision or assistance, could be insufficient if the patient is too disoriented or unable to comply, again risking patient harm and failing to meet the standard of care. Professionals should employ a decision-making framework that involves rapid assessment of the patient's condition, immediate communication with the supervising dentist, and adherence to pre-established emergency protocols. This framework emphasizes acting within one's scope of practice, prioritizing patient safety, and ensuring appropriate supervision and delegation of tasks during medical emergencies. Question 4. During the evaluation of a new patient presenting for a routine dental procedure requiring local anesthesia, the patient's medical history reveals uncontrolled hypertension and a recent history of myocardial infarction within the last 6 months. The supervising dentist has indicated the need for profound anesthesia and good hemostasis. Considering the available local anesthetic agents and their vasoconstrictor components, which of the following actions is the most appropriate for the dental anesthesia assistant to take? Option A. Administer a local anesthetic without a vasoconstrictor to minimize cardiovascular stress. Option B. Proceed with a local anesthetic containing a higher concentration of epinephrine to ensure adequate anesthetic duration. Option C. Select a local anesthetic formulation containing epinephrine, as it is the most effective vasoconstrictor for achieving hemostasis and profound anesthesia. Option D. Choose a local anesthetic with levonorepinephrine, as it is a less potent vasoconstrictor than epinephrine and may be suitable. Correct answer is C. Select a local anesthetic formulation containing epinephrine, as it is the most effective vasoconstrictor for achieving hemostasis and profound anesthesia. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's medical history directly impacts the safe administration of local anesthetic. The presence of significant cardiovascular disease, specifically uncontrolled hypertension, and a history of myocardial infarction, necessitates careful consideration of vasoconstrictor use. The dental anesthesia assistant, DAA, must understand the pharmacological actions of vasoconstrictors like epinephrine and levonorepinephrine, their potential adverse effects, and the contraindications for their use to ensure patient safety and adhere to professional standards. The challenge lies in balancing the benefits of vasoconstriction, hemostasis, prolonged anesthetic effect, against the risks to a compromised patient. Correct approach analysis. The correct approach prioritizes patient safety by recognizing the contraindications for epinephrine. Epinephrine is a potent sympathomimetic amine that can increase heart rate, blood pressure, and myocardial oxygen demand. In a patient with uncontrolled hypertension and a recent myocardial infarction, the administration of epinephrine could precipitate a cardiac event, such as angina, myocardial infarction, or stroke. Therefore, opting for a local anesthetic without a vasoconstrictor, or one with a less potent vasoconstrictor, if deemed absolutely necessary and approved by the supervising dentist after further assessment, is the safest and most professionally responsible course of action. This aligns with the ethical imperative to do no harm and the regulatory requirement for DAAs to practice within their scope and under appropriate supervision. Ensuring patient well-being is paramount. Incorrect approach is analysis. Administering a local anesthetic with epinephrine without further consultation or consideration of the patient's history is a direct violation of patient safety protocols and potentially regulatory guidelines. This approach ignores the known risks of epinephrine in patients with cardiovascular compromise, leading to a high probability of adverse events. This constitutes a failure in professional judgment and a breach of the duty of care. Administering a local anesthetic with levonorepinephrine without considering the patient's specific cardiovascular conditions is also professionally unacceptable. While levonorepinephrine is generally considered less potent than epinephrine, it still possesses vasoconstrictive properties and can affect blood pressure and heart rate. In a patient with uncontrolled hypertension, its use may still pose a significant risk, and a thorough risk-benefit analysis, ideally involving the supervising dentist, is required. Failing to do so represents a lapse in due diligence. Administering a local anesthetic with a higher concentration of epinephrine than typically used, assuming it will be more effective, is a dangerous and incorrect approach. Higher concentrations do not necessarily equate to increased safety, and in this patient's case, would significantly amplify the risks associated with epinephrine. This demonstrates a fundamental misunderstanding of vasoconstrictor pharmacology and a disregard for patient-specific contraindications. Professional reasoning. When faced with a patient presenting with significant medical history that may contraindicate certain pharmacological agents, the DAA must engage in a systematic decision-making process. This involves 1. Thoroughly reviewing the patient's medical history and identifying potential risk factors. 2. Understanding the pharmacological actions and contraindications of all medications to be administered, including local anesthetics and their additives. 3. Consulting with the supervising dentist to discuss the identified risks and collaboratively determine the safest treatment plan. 4. Prioritizing patient safety above all other considerations, including convenience or perceived efficacy of a particular agent. 5. Documenting all findings, consultation, and decisions made. Question 5. The audit findings indicate that a dental anesthesia assistant DAA was observed during a pre-anesthetic evaluation. Which of the following actions best demonstrates adherence to regulatory requirements for physical examination of the airway, lungs, and heart? Option A. Performing a brief visual inspection of the oral cavity and asking the patient if they have any heart conditions without formal auscultation. Option B. Documenting the patient's stated ability to breathe easily and noting the absence of any reported chest pain without a physical examination of the lungs or heart. Option C. conducting a thorough assessment of the patient's airway, including evaluation of Malampati classification and thyromental distance, auscultating lung fields for adventitious sounds, and listening to heart sounds for murmurs or irregularities. Option D. Reviewing the patient's medical history form and noting any reported breathing difficulties without performing a physical lung auscultation. The correct answer is C. Conducting a thorough assessment of the patient's airway, including evaluation of Malampati classification and thyromental distance, auscultating lung fields for adventitious sounds, and listening to heart sounds for murmurs or irregularities. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a critical patient safety assessment during a pre-anesthetic evaluation. The dental anesthesia assistant, DAA, must accurately interpret physical findings related to the airway, lungs, and heart to identify potential risks that could impact anesthetic management and patient outcomes. Failure to perform a thorough and accurate assessment can lead to delayed recognition of contraindications or necessary modifications to the anesthetic plan, potentially resulting in adverse events. The DAA's role requires a high degree of vigilance and the ability to correlate physical signs with anesthetic risks. Correct approach analysis. The correct approach involves a systematic and comprehensive physical examination focusing on the airway, lungs, and heart. This includes assessing airway patency, e.g., Malampati score, thyromental distance, mouth opening, listening to lung sounds for abnormalities, e.g., wheezes, crackles, and auscultating heart sounds for murmurs or arrhythmias. This aligns with the fundamental principles of patient assessment and risk stratification mandated by dental anesthesia regulatory bodies, which require the DAA to assist in identifying factors that may influence anesthetic safety. By performing this detailed examination, the DAA contributes essential information to the anesthesiologist, enabling informed decision-making regarding anesthetic technique, monitoring, and emergency preparedness, thereby upholding the highest standards of patient care and regulatory compliance. Incorrect approach is analysis. One incorrect approach is to rely solely on the patient's self-reported history without performing a physical examination. This is a regulatory failure as it bypasses a mandatory component of the pre-anesthetic assessment, which is to objectively evaluate the patient's physical status. Ethically, it represents a dereliction of duty to the patient by not conducting a thorough evaluation. Another incorrect approach is to perform a superficial examination, only briefly listening to the lungs and heart without specific attention to airway assessment. This is a failure to meet the expected standard of care for a DAA. Regulatory guidelines emphasize the importance of airway assessment due to its direct impact on anesthetic administration and potential for complications. Omitting or inadequately performing this critical step can lead to significant patient harm. A third incorrect approach is to document findings without understanding their clinical significance or communicating potential risks to the supervising anesthesiologist. This demonstrates a lack of critical thinking and professional responsibility. Regulatory frameworks expect the DAA to not only gather data, but also to contribute to the interpretation of that data in the context of anesthetic safety. Failing to do so undermines the collaborative nature of patient care and can lead to missed opportunities for intervention. Professional reasoning. Professionals should approach pre-anesthetic physical examinations with a structured methodology, ensuring all critical areas are assessed. This involves understanding the purpose of each component of the examination, how airway assessment informs intubation difficulty, how lung sounds reveal respiratory compromise, and how heart sounds indicate cardiac status. When faced with findings that deviate from normal, the professional reasoning process should involve 1. Recognizing the abnormality, 2. Considering its potential implications for anesthesia, 3. Documenting the finding accurately, and 4. Promptly and clearly communicating the concern to the supervising anesthesiologist. This systematic approach ensures that patient safety is paramount and that all available information is used to optimize the anesthetic plan. Question 6. The monitoring system demonstrates a prolonged period of reduced respiratory rate and delayed response to verbal stimuli during the emergence phase of anesthesia, suggesting that the anesthetic agent's pharmacokinetic profile is not following the expected pattern of rapid excretion. What is the most appropriate immediate action for the dental anesthesia assistant? Option A. Focus on documenting the patient's vital signs during induction, as the recovery phase is less critical for data collection. Option B. Assume the patient is simply experiencing a deeper level of sedation and wait for spontaneous recovery without further intervention or reporting. Option C. Administer a standard dose of a respiratory stimulant to expedite the patient's recovery. Option D. Continue to monitor the patient closely and immediately report the findings to the supervising dentist, detailing the observed physiological changes and the suspected pharmacokinetic issue. Correct answer is D. Continue to monitor the patient closely and immediately report the findings to the supervising dentist, detailing the observed physiological changes and the suspected pharmacokinetic issue. Explanation: this scenario is professionally challenging because it requires the dental anesthesia assistant, DAA, to interpret physiological data in the context of pharmacokinetics, specifically focusing on the elimination phase of anesthetic agents. The DAA must understand how the body processes and removes these drugs to ensure patient safety during and after the procedure. The challenge lies in recognizing subtle deviations from expected recovery patterns and understanding the implications for patient well-being, all while adhering to strict regulatory guidelines for patient monitoring and care. The correct approach represents best professional practice because it directly addresses the DAA's responsibility to monitor patient recovery from anesthesia. By recognizing that a prolonged emergence from anesthesia, indicated by the monitoring system's data, suggests a potential issue with the drug's excretion or metabolism, the DAA is acting proactively. This aligns with the regulatory framework that mandates vigilant patient observation and prompt reporting of any concerning signs to the supervising dentist. The DAA's role is to be the eyes and ears of the dentist, identifying deviations that could compromise patient safety. This proactive stance ensures that any adverse reactions or prolonged effects are addressed swiftly, minimizing potential harm. An incorrect approach that focuses solely on the initial induction phase fails to acknowledge the critical importance of the recovery period. The regulatory framework emphasizes continuous monitoring throughout the entire anesthetic process, including emergence and recovery. Ignoring signs of delayed excretion or metabolism during this phase is a direct violation of this mandate and constitutes a significant ethical failure, as it prioritizes convenience over patient safety. Another incorrect approach that involves administering a reversal agent without explicit instruction from the supervising dentist is a serious regulatory and ethical breach. The DAA's scope of practice is defined by the supervising dentist and regulatory bodies. Administering medications, especially reversal agents, without proper authorization constitutes practicing beyond one's scope and could lead to dangerous drug interactions or an inappropriate response to the patient's condition. This bypasses the established chain of command and undermines the dentist's ultimate responsibility for patient care. A further incorrect approach that dismisses the monitoring data as normal variation without further investigation is also professionally unacceptable. While some variation is expected, a sustained pattern of delayed recovery, as suggested by the monitoring system, warrants further assessment. The regulatory framework expects DAAs to exercise sound clinical judgment and not to overlook potentially significant physiological changes. This approach demonstrates a lack of critical thinking and a failure to uphold the standard of care expected of a DAA. The professional reasoning process for similar situations should involve a systematic approach. 1. Observe and interpret all available monitoring data. 2. Correlate the data with the patient's clinical presentation and the anesthetic agents used. 3. Identify any deviations from expected physiological parameters, particularly during the emergence and recovery phases. 4. Consult the established protocols and the supervising dentist immediately if any concerns arise. 5. Document all observations and actions taken. This structured approach ensures that patient safety remains paramount and that all actions are compliant with regulatory requirements and ethical standards. Question 7. Regulatory review indicates that dental anesthesia assistants DAA are responsible for pre-anesthetic patient assessment. A patient reports experiencing intermittent jaw clicking and occasional discomfort when opening their mouth widely, stating, "It feels a bit tight sometimes, especially in the morning." The DAA is preparing the patient for a routine dental procedure requiring local anesthesia with sedation. How should the DAA proceed with this information? Option A. Document the patient's description of jaw clicking and discomfort, and then immediately inform the supervising dentist of these symptoms before proceeding with the anesthetic plan. Option B. Record the patient's statement about jaw discomfort as a minor observation and proceed with the anesthetic plan without further consultation, assuming it is not relevant to the sedation. Option C. Advise the patient that jaw clicking is common and likely unrelated to the dental procedure, then proceed with the anesthetic plan as scheduled. Option D. Ask the patient to perform specific jaw exercises to see if the clicking or discomfort improves, and then proceed with the anesthetic plan if symptoms subside. The correct answer is A. Document the patient's description of jaw clicking and discomfort, and then immediately inform the supervising dentist of these symptoms before proceeding with the anesthetic plan. Explanation. This scenario presents a professional challenge due to the potential for misinterpreting patient-reported symptoms and the critical need for accurate assessment before administering anesthesia. The dental anesthesia assistant DAA is tasked with gathering information that directly impacts patient safety and the effectiveness of the planned procedure. The temporomandibular joint, TMJ, is a complex anatomical structure, and its disorders can manifest in various ways, some of which might contraindicate or require modification of standard anesthetic protocols. A DAA's ethical and professional responsibility is to ensure all relevant patient information is accurately collected and communicated to the supervising dentist. The correct approach prioritizes patient safety and adherence to established protocols by seeking clarification and additional information when faced with ambiguous or potentially significant symptoms. This aligns with the DAA's role as a support professional who must operate within their scope of practice and under the direction of a licensed dentist. By documenting the patient's description of pain and its location, and then consulting with the dentist, the DAA ensures that the dentist has the most complete and accurate information to make an informed decision about the anesthetic plan. This proactive communication is a cornerstone of safe dental anesthesia practice and directly addresses the regulatory framework's emphasis on patient well-being and accurate record-keeping. An incorrect approach would involve making assumptions about the patient's condition or dismissing their symptoms without proper investigation. For instance, assuming the reported jaw pain is unrelated to the dental procedure or anesthesia, or simply documenting it without further inquiry or consultation, would be a failure to exercise due diligence. This could lead to an anesthetic plan that exacerbates existing TMJ issues, causes patient discomfort, or even leads to more serious complications. Such an approach would violate ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also fails to meet regulatory requirements for thorough patient assessment and accurate documentation, potentially leading to professional disciplinary action. Another incorrect approach would be to provide a diagnosis or treatment recommendation for the TMJ disorder, as this falls outside the DAA's scope of practice and would constitute practicing dentistry without a license. The professional decision-making process in such situations should involve a systematic approach. 1. Recognize and acknowledge the patient's reported symptoms. 2. Gather specific details about the symptoms, location, nature, duration, aggravating/alleviating factors. 3. Assess the potential relevance of the symptoms to the planned dental procedure and anesthesia. 4. Consult with the supervising dentist, providing all gathered information clearly and concisely. 5. Follow the dentist's instructions regarding further assessment or modifications to the anesthetic plan. 6. Document all findings and actions accurately in the patient's record. Question 8. Risk assessment procedures indicate that a patient scheduled for dental sedation reports a history of heart flutter and is currently taking a water pill for blood pressure. The patient also mentions occasional shortness of breath when climbing stairs. What is the most appropriate immediate action for the dental anesthesia assistant, DAA, to take? Option A. Advise the patient that their symptoms may be too severe for sedation and suggest they reschedule their appointment after consulting with their primary physician. Option B. Immediately inform the supervising anesthesia provider of the reported heart flutter, shortness of breath, and the water pill, and request further clarification on the patient's cardiac and respiratory status before proceeding. Option C. Document the reported symptoms and medications and proceed with preparing the patient for sedation as planned, assuming the anesthesia provider will manage any issues. Option D. Ask the patient to describe the water pill and its dosage, and then proceed with sedation if the information seems manageable, without consulting the anesthesia provider. The correct answer is C. Document the reported symptoms and medications, and proceed with preparing the patient for sedation as planned, assuming the anesthesia provider will manage any issues. Explanation. This scenario is professionally challenging because the dental anesthesia assistant, DAA, must synthesize potentially conflicting or incomplete information from a patient's medical history to identify risks relevant to anesthesia administration. The DAA's role is to support the anesthesia provider by ensuring all pertinent information is gathered and understood, thereby contributing to patient safety. This requires a nuanced understanding of how various medical conditions and medications can impact anesthetic management. The correct approach represents best professional practice because it prioritizes a thorough and systematic review of the patient's medical history, actively seeking clarification and additional information when gaps or ambiguities exist. This aligns with the fundamental ethical and regulatory obligation to ensure patient safety by thoroughly understanding their medical status before administering anesthesia. Specifically, it reflects the DAA's responsibility to identify potential contraindications, drug interactions, or conditions that may necessitate modifications to the anesthetic plan or require specific monitoring. This proactive approach minimizes the risk of adverse events. An incorrect approach that involves overlooking or downplaying reported symptoms or conditions is a significant regulatory and ethical failure. It violates the principle of do no harm and can lead to serious patient injury or death. Such an approach demonstrates a lack of diligence and a failure to adhere to established protocols for patient assessment, which are mandated by regulatory bodies overseeing dental anesthesia practice. Furthermore, it undermines the collaborative nature of patient care, failing to adequately inform the anesthesia provider of potential risks. Another incorrect approach, such as relying solely on the patient's self-reporting without further inquiry or verification, can be insufficient. While patient input is crucial, certain conditions or medications may not be fully understood or accurately recalled by the patient. A responsible DAA must be able to identify when further investigation, such as consulting with the patient's physician or reviewing previous medical records, is necessary to ensure a comprehensive risk assessment. This failure to seek necessary clarification can lead to an incomplete understanding of the patient's risk profile. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate the review with a clear understanding of the DAA's scope of practice and responsibilities within the specific regulatory framework. 2. Systematically review all available medical history components, including past medical conditions, surgical history, allergies, current medications, and social history. 3. Actively identify any reported symptoms, conditions, or medications that could pose a risk during anesthesia. This includes considering potential airway issues, cardiovascular stability, respiratory function, and drug interactions. 4. If any information is unclear, incomplete, or raises concerns, seek immediate clarification from the patient or the supervising anesthesia provider. This may involve asking targeted follow-up questions or requesting additional information. 5. Document all findings, inquiries, and decisions thoroughly. 6. Communicate all identified risks and relevant patient information clearly and concisely to the anesthesia provider. Question 9. System analysis indicates that a dental anesthesia assistant, DAA, is monitoring a patient undergoing a dental procedure with intravenous sedation. The pulse oximeter displays a SpO2 of 92%. The capnography shows an end-tidal CO2 at CO2 of 48 mmHg, and the blood pressure monitor indicates a systolic pressure of 110 mmHg. Which of the following represents the most appropriate immediate action for the DAA? Option A. Immediately increase the oxygen flow rate and alert the dentist to a potential hypoxemia event. Option B. Document the current readings and continue to observe, as the SpO2 is still within an acceptable range for sedation. Option C. Focus on adjusting the patient's position to improve the pulse oximeter reading, assuming it is the primary issue. Option D. Assess the patient's chest rise and fall, check the capnography waveform for adequacy, and report the combined findings to the supervising dentist. The correct answer is D. Assess the patient's chest rise and fall, check the capnography waveform for adequacy, and report the combined findings to the supervising dentist. Explanation. Scenario analysis. This scenario presents a common challenge in dental anesthesia where a patient's physiological status can change rapidly. The professional challenge lies in accurately interpreting multiple streams of monitoring data to identify subtle deviations from baseline and potential complications. A dental anesthesia assistant, DAA, must possess a thorough understanding of normal physiological parameters, the expected effects of anesthetic agents, and the significance of changes indicated by each piece of equipment. The ability to synthesize this information and communicate critical findings to the supervising dentist is paramount for patient safety. Correct approach analysis. The correct approach involves a systematic and integrated assessment of all available monitoring data. This means not just looking at individual readings, but understanding how they relate to each other and to the patient's overall clinical presentation. For example, a slight drop in SpO2 might be concerning, but if the capnography shows a stable end-tidal CO2 and the blood pressure is unchanged, the interpretation might differ from a scenario where all parameters are trending downwards. This integrated approach aligns with best professional practice by ensuring a comprehensive understanding of the patient's condition, thereby enabling timely and appropriate intervention. Regulatory frameworks for DAAs emphasize the importance of vigilant patient monitoring and the ability to recognize and report deviations from normal. This approach directly supports the ethical obligation to provide safe patient care and uphold the standards of the profession. Incorrect approaches analysis. Focusing solely on one piece of equipment, such as only the pulse oximeter, is a significant regulatory and ethical failure. While the pulse oximeter is a vital tool, it provides only one aspect of respiratory and circulatory status. For instance, a patient could have a normal SpO2 reading but be hypoventilating, leading to CO2 retention, which would be evident on capnography. Ignoring other monitors like the blood pressure monitor could lead to missing critical cardiovascular events. Similarly, relying only on the ECG without considering other vital signs might lead to misinterpreting arrhythmias or failing to recognize their systemic impact. These isolated assessments fail to meet the comprehensive monitoring requirements mandated by DAA regulations, which expect a holistic view of the patient's well-being. Professional reasoning. Professionals should approach patient monitoring by establishing a baseline for each parameter before the anesthetic begins. During the procedure, they should continuously observe all monitors, looking for trends rather than isolated values. A systematic approach, often referred to as head-to-toe or by vital sign category, airway, breathing, circulation, can help ensure all aspects are covered. When any parameter deviates from the established baseline or expected range, the DAA should first verify the reading, e.g., check lead placement, ensure proper cuff inflation, and then immediately communicate the finding and their interpretation to the supervising dentist. This proactive and communicative approach is the cornerstone of safe dental anesthesia practice. Question 10. Implementation of patient monitoring protocols during dental anesthesia procedures by a dental anesthesia assistant DAA requires a nuanced understanding of their responsibilities. Which of the following best describes the DAA's role in this context? Option A. The DAA may independently adjust anesthetic dosages based on their observation of patient comfort levels. Option B. The DAA is responsible for continuously monitoring patient vital signs and reporting any deviations from baseline to the supervising dentist immediately. Option C. The DAA's primary role is to prepare the operatory and equipment, with patient monitoring being solely the responsibility of the supervising dentist. Option D. The DAA is responsible for administering the anesthetic agent and monitoring the patient's response. The correct answer is B. The DAA is responsible for continuously monitoring patient vital signs and reporting any deviations from baseline to the supervising dentist immediately. Explanation. This scenario presents a professional challenge due to the critical nature of patient safety during anesthesia administration and the varying levels of training and scope of practice for dental professionals. A dental anesthesia assistant DAA must operate strictly within their defined role and the supervising dentist's orders, ensuring all actions are permissible and contribute to safe patient care. Careful judgment is required to differentiate between assisting duties and independent practice. The correct approach represents best professional practice because it aligns with the fundamental principles of dental anesthesia assistants as defined by regulatory frameworks. This involves the DAA performing tasks explicitly within their scope of practice, under the direct supervision of a licensed dentist who is qualified to administer anesthesia. This adherence ensures that patient care is delivered by appropriately trained and licensed individuals, minimizing risks associated with anesthesia. Regulatory guidelines for DAAs typically emphasize their supportive role, focusing on patient monitoring, equipment preparation, and assisting the dentist, rather than independent decision-making regarding anesthetic agents or procedures. An incorrect approach that involves the DAA independently selecting or adjusting anesthetic agents would represent a significant regulatory and ethical failure. This action exceeds the DAA's scope of practice, which is legally defined and enforced by dental boards. Such an action would constitute the unlicensed practice of dentistry or anesthesia administration, posing a direct threat to patient safety and violating professional conduct standards. Another incorrect approach, such as failing to report a change in patient vital signs to the supervising dentist, is an ethical lapse and a failure to uphold the duty of care. The DAA has a responsibility to monitor the patient and communicate critical information promptly, as patient well-being is paramount. This failure could lead to delayed intervention and adverse outcomes. Professional decision-making in such situations requires a clear understanding of one's scope of practice, the specific protocols established by the dental practice, and the direct instructions of the supervising dentist. When faced with uncertainty, the professional standard is to seek clarification from the supervising dentist before proceeding. This hierarchical approach ensures that all actions are authorized, understood, and contribute to a safe and effective patient care plan. Question 11. The control framework reveals that a dental anesthesia assistant DAA is preparing to administer local anesthesia for a mandibular block. Which of the following actions demonstrates the most critical application of head and neck anatomy knowledge to ensure patient safety and procedural efficacy? Option A. Relying on the patient's description of their pain to guide the injection site without precise anatomical verification. Option B. Injecting the anesthetic solution at the lingual aspect of the mandibular molars, assuming this will reach the target nerve. Option C. Accurately palpating the anterior border of the ascending ramus and the coronoid notch to identify the correct anatomical region for needle insertion. Option D. Administering the anesthetic solution based on a general understanding of where the inferior alveolar nerve typically travels. The correct answer is C. Accurately palpating the anterior border of the ascending ramus and the coronoid notch to identify the correct anatomical region for needle insertion. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of anatomical knowledge for a dental anesthesia assistant DAA in ensuring patient safety during procedures. Misunderstanding or misapplication of anatomical landmarks can lead to incorrect administration of local anesthetics, potentially causing nerve damage, inadequate pain control, or systemic complications. The DAA must possess a precise understanding of the head and neck anatomy to identify target areas for injection and avoid vital structures. Correct approach analysis. The correct approach emphasizes the DAA's responsibility to accurately identify and palpate specific anatomical landmarks, such as the infraorbital foramen, mental foramen, and greater palatine foramen, prior to administering local anesthesia. This aligns with the regulatory framework for DAAs, which mandates competency in administering local anesthesia under the supervision of a licensed dentist. Best professional practice dictates that the DAA must have a thorough understanding of the underlying bony structures and soft tissues to ensure the anesthetic solution is deposited in the correct location for effective and safe nerve blockade. This minimizes the risk of complications and ensures optimal patient comfort and procedural success, adhering to the ethical obligation of beneficence and non-maleficence. Incorrect approach is analysis. One incorrect approach involves relying solely on visual cues without palpation of bony landmarks. This is a regulatory failure because it deviates from established protocols for safe and effective local anesthetic administration, which require tactile confirmation of anatomical position. Ethically, it compromises patient safety by increasing the risk of inaccurate deposition and potential nerve injury. Another incorrect approach is to administer anesthesia based on a general understanding of the area without precise identification of specific foramina. This is a significant regulatory and ethical failure. The DAA's scope of practice, as defined by the regulatory framework, requires specific knowledge and application of anatomical landmarks for safe anesthesia delivery. Failure to do so can lead to ineffective anesthesia, requiring repeat injections or more complex management, and increases the risk of adverse events, violating the duty of care. A further incorrect approach is to assume the patient's anatomy standard and proceed without verifying landmarks, especially in cases where anatomical variations might exist. This is a failure to adhere to the principle of individualized patient care, a cornerstone of ethical practice and regulatory compliance. While anatomical variations are not uncommon, a DAA must be prepared to adapt their technique based on palpation and assessment, rather than making assumptions that could jeopardize patient safety. Professional reasoning. Professionals should approach local anesthetic administration with a systematic process. This begins with a thorough review of the patient's chart and any relevant imaging. Next, the DAA must mentally review the relevant anatomy for the planned procedure. During the procedure, precise palpation of bony landmarks is paramount to confirm the intended injection site. If any doubt arises regarding the accuracy of the landmark identification, the DAA should consult with the supervising dentist before proceeding. This iterative process of knowledge recall, visual assessment, tactile confirmation, and consultation ensures that the highest standards of patient safety and procedural efficacy are met, in full compliance with regulatory requirements and ethical obligations. Question 12. Strategic planning requires a dental anesthesia assistant DAA to accurately identify the primary cranial nerve responsible for sensory innervation to the majority of the oral cavity and face, as well as its motor function related to mastication when administering local anesthetics. Which cranial nerve is this, and what is its primary role in this context? Option A. The trigeminal nerve V, providing sensory innervation to the face and oral cavity and motor control for mastication. Option B. The glossopharyngeal nerve Roman 9, responsible for taste, sensation in the pharynx and parotid gland innervation. Option C. The facial nerve Roman 7, primarily responsible for facial expressions and taste sensation. Option D. The vagus nerve X, involved in autonomic functions and sensation in the pharynx and larynx. The correct answer is A. The trigeminal nerve V, providing sensory innervation to the face and oral cavity and motor control for mastication. Explanation. This scenario is professionally challenging because it requires the dental anesthesia assistant DAA to accurately identify the cranial nerves involved in specific dental anesthesia procedures and understand their sensory and motor functions to ensure patient safety and effective treatment. Misidentification or misunderstanding of these nerve pathways can lead to inadequate anesthesia, nerve damage, or other adverse patient outcomes. Careful judgment is required to apply theoretical knowledge of neuroanatomy to practical clinical situations. The correct approach represents best professional practice because it demonstrates a thorough understanding of the trigeminal nerve's primary role in facial sensation and motor control of mastication, which is fundamental to administering local anesthesia in the oral cavity. It also acknowledges the potential involvement of other cranial nerves in specific scenarios, such as the facial nerve in relation to the parotid gland or the glossopharyngeal nerve in gag reflexes, which a competent DAA must be aware of for comprehensive patient care and to anticipate potential complications. This aligns with the DAA's scope of practice, which necessitates a strong foundation in head and neck anatomy and physiology relevant to dental anesthesia. An incorrect approach that focuses solely on the trigeminal nerve without considering potential contributions from other cranial nerves for specific anesthetic techniques or patient presentations is professionally unacceptable. This demonstrates a lack of comprehensive anatomical knowledge and can lead to incomplete pain management or failure to recognize and manage associated risks. For instance, if a procedure inadvertently affects branches of the facial nerve, a DAA solely focused on the trigeminal nerve might miss signs of facial paralysis. Similarly, an approach that overemphasizes the vagus nerve's role in dental anesthesia is incorrect, as its primary functions are in the thoracic and abdominal cavities and the pharynx/larynx, with limited direct involvement in typical dental local anesthetic administration, though it plays a role in autonomic responses. The professional decision-making process for similar situations should involve a systematic review of the patient's dental needs, the proposed anesthetic technique, and the relevant neuroanatomy. Professionals should ask, which cranial nerves are primarily responsible for sensation and motor function in the target area? And are there any anatomical variations or procedural considerations that might involve other cranial nerves? This iterative process of knowledge application, risk assessment, and consideration of potential complications ensures that the chosen anesthetic approach is safe, effective, and ethically sound, adhering to the highest standards of patient care. Question 13. Quality control measures reveal that a patient undergoing a dental procedure requiring benzodiazepine sedation is exhibiting significantly prolonged recovery, remaining drowsy and disoriented well past the expected discharge time. The supervising dentist is momentarily occupied with another patient. What is the most appropriate immediate course of action for the dental anesthesia assistant DAA? Option A. Advise the patient that they are taking longer to recover than usual and suggest they wait an additional hour before reassessment. Option B. Continue to monitor the patient's vital signs and level of consciousness and immediately inform the supervising dentist of the prolonged recovery, requesting their assessment and guidance. Option C. Initiate the administration of flumazenil as per a standing order for prolonged benzodiazepine effects, while simultaneously attempting to contact the supervising dentist. Option D. Administer flumazenil to the patient based on the DAA's clinical judgment that the patient is experiencing an adverse reaction to the benzodiazepine. Correct answer is C. Initiate the administration of flumazenil as per a standing order for prolonged benzodiazepine effects, while simultaneously attempting to contact the supervising dentist. Explanation. Scenario analysis. This scenario presents an ethical dilemma concerning patient safety and professional responsibility when a prescribed medication's effects are unexpectedly prolonged. The dental anesthesia assistant DAA is faced with a situation where a patient is experiencing residual sedation beyond the expected recovery period, potentially impacting their ability to safely leave the clinic. The challenge lies in balancing the need for prompt intervention with the requirement to act within the scope of practice and under appropriate supervision, while also considering the patient's well-being and the potential for adverse events. Correct approach analysis. The correct approach involves recognizing the deviation from expected recovery, communicating the observation to the supervising dentist, and collaboratively discussing the potential need for reversal with flumazenil. This aligns with best professional practice by prioritizing patient safety through vigilant monitoring and timely reporting of concerns. It adheres to regulatory frameworks that mandate DAAs to work under the direct supervision of a licensed dentist and to report any patient complications or deviations from the norm. The decision to administer flumazenil, if deemed necessary, must be made by the supervising dentist, who has the ultimate responsibility for patient care and prescribing authority. This collaborative approach ensures that any intervention is clinically justified, appropriate for the patient's condition, and within the legal and ethical boundaries of both the DAA and the dentist. Incorrect approach is analysis. Administering flumazenil without explicit instruction or authorization from the supervising dentist is a significant regulatory and ethical failure, constitutes practicing beyond the scope of the DAA's license and authority, potentially leading to patient harm if the reversal agent is not indicated or if there are contraindications. This action bypasses the established chain of command and undermines the dentist's responsibility for patient management. Another incorrect approach would be to dismiss the prolonged sedation as a minor inconvenience and allow the patient to leave without further assessment or intervention. This failure to act constitutes negligence and a breach of the professional duty of care, as the patient may be at risk of injury due to impaired cognitive function and motor skills. It violates the ethical principle of non-maleficence, do no harm, and the regulatory requirement to ensure patient safety post-procedure. Professional reasoning. In such situations, a DAA should follow a structured decision-making process. 1. Observe and assess. Continuously monitor the patient's vital signs and level of consciousness. 2. Report and communicate. Immediately inform the supervising dentist of any concerning observations or deviations from expected recovery. 3. Collaborate and discuss. Engage in a professional dialogue with the dentist regarding the patient's condition and potential treatment options. 4. Follow directives. Act only under the explicit direction and supervision of the dentist, ensuring all actions are within the scope of practice and regulatory guidelines. 5. Document. Meticulously record all observations, communications, and interventions. Question 14. Investigation of a patient who, shortly after the administration of a local anesthetic by the supervising dentist, begins to exhibit signs of restlessness, tremors, and slurred speech, followed by a period of confusion. The dental anesthesia assistant DAA is present and observes these changes. What is the most appropriate immediate action for the DAA to take? Option A. Continue the administration of the local anesthetic as planned, assuming the patient is simply anxious. Option B. Administer a mild sedative to calm the patient before informing the dentist. Option C. Proceed with the dental procedure while monitoring the patient's symptoms from a distance. Option D. Immediately discontinue the administration of the local anesthetic, administer supplemental oxygen, and alert the supervising dentist. Correct answer is D. Immediately discontinue the administration of the local anesthetic, administer supplemental oxygen, and alert the supervising dentist. Explanation: this scenario is professionally challenging because it involves a potential adverse reaction to a local anesthetic, requiring immediate and accurate assessment of the patient's condition and appropriate intervention. The dental anesthesia assistant DAA must act swiftly while adhering to established protocols and understanding the pharmacological properties of the administered agent. The DAA's role is to support the supervising dentist and ensure patient safety, which includes recognizing signs of complications and initiating the correct response. The correct approach represents best professional practice because it prioritizes patient well-being and follows established emergency protocols for local anesthetic toxicity. This involves recognizing the signs and symptoms of systemic toxicity, e.g., central nervous system excitation followed by depression, cardiovascular effects, immediately discontinuing the anesthetic administration, providing supportive care such as administering oxygen, and alerting the supervising dentist. This aligns with the DAA's scope of practice and the ethical obligation to act in the patient's best interest. Adherence to these steps ensures prompt management of a potentially life-threatening situation. An incorrect approach of continuing the anesthetic administration would be a severe regulatory and ethical failure. It directly violates the principle of do no harm and demonstrates a lack of understanding of local anesthetic pharmacology and toxicity. This action could exacerbate the patient's condition, leading to more severe consequences, including seizures or cardiovascular collapse. Another incorrect approach of delaying notification of the supervising dentist is also a critical failure. The DAA is part of a team, and the supervising dentist must be informed immediately of any patient distress or suspected adverse reaction to provide appropriate medical direction and management. This delay compromises patient care and violates professional responsibility. Finally, an incorrect approach of attempting to manage the situation independently without alerting the dentist or following established emergency protocols would be a significant breach of professional conduct and regulatory guidelines, as the DAA's scope of practice is to assist and support, not to independently manage complex medical emergencies. Professionals should employ a systematic decision-making process when faced with such a situation. This involves 1. Rapid assessment of the patient's signs and symptoms. 2. Immediate recognition of potential adverse events. 3. Adherence to pre-established emergency protocols. 4. Clear and immediate communication with the supervising dentist. And 5. Provision of supportive care within the scope of practice. This structured approach ensures that patient safety remains paramount and that all necessary steps are taken in a timely and effective manner. Question 15. What factors determine the appropriate level of DAA involvement and preparedness for advanced airway management, such as laryngoscopy and endotracheal intubation, within the scope of dental anesthesia practice? Option A. The anesthesia provider's verbal confirmation that the DAA is adequately trained without specific assessment of the patient or procedure. Option B. The patient's airway anatomy, the complexity of the planned procedure, the anesthesia provider's experience, and the availability of emergency equipment and protocols. Option C. The dental office's general preparedness for medical emergencies, regardless of the specific airway management needs. Option D. The DAA's personal preference for assisting with airway procedures and the perceived urgency of the situation. The correct answer is B. The patient's airway anatomy, the complexity of the planned procedure, the anesthesia provider's experience, and the availability of emergency equipment and protocols. Explanation: scenario analysis. Managing advanced airway procedures like laryngoscopy and endotracheal intubation in a dental anesthesia setting presents significant professional challenges. These challenges stem from the inherent risks associated with airway manipulation in a supine patient, often with limited access and visibility, and the potential for rapid patient decompensation. The DAA's role is critical in supporting the anesthesia provider, requiring a high degree of vigilance, technical proficiency, and the ability to anticipate and respond to complications. The decision-making process must be swift, evidence-based, and aligned with established protocols to ensure patient safety. Correct approach analysis. The correct approach prioritizes patient safety and adherence to established dental anesthesia guidelines and regulations. This involves a comprehensive pre-procedure assessment, including patient history, airway evaluation, and confirmation of appropriate equipment availability and functionality. During the procedure, continuous patient monitoring, effective communication with the anesthesia provider, and readiness to assist with airway adjuncts or suction are paramount. Post-procedure, vigilance for airway patency and signs of complications is essential. This approach is justified by regulatory frameworks that mandate patient safety, require qualified personnel to perform or assist in procedures, and emphasize the importance of emergency preparedness. Ethical principles of beneficence and non-maleficence are upheld by ensuring that all actions are taken in the patient's best interest and to avoid harm. Incorrect approaches analysis. An incorrect approach would involve proceeding with advanced airway management without a thorough pre-procedure assessment, neglecting to confirm the availability of necessary equipment, or failing to maintain continuous patient monitoring. This could lead to delays in managing complications, inadequate support for the anesthesia provider, and an increased risk of patient injury, such as hypoxemia, trauma to airway structures, or aspiration. Such actions would violate regulatory requirements for competent practice and patient care standards. Ethically, this demonstrates a failure to uphold the duty of care and could be considered negligence. Another incorrect approach would be to assume the anesthesia provider has all necessary equipment and is solely responsible for monitoring, thereby abdicating the DAA's supportive role. This neglects the collaborative nature of dental anesthesia and the DAA's specific responsibilities in ensuring a safe environment and assisting in emergencies. Professional reasoning. Professionals should employ a structured decision-making framework that begins with a thorough understanding of the patient's condition and the planned procedure. This includes a risk assessment and the identification of potential complications. The DAA must then ensure all necessary equipment is readily available and functional, and that they are prepared to assist the anesthesia provider effectively. Continuous assessment of the patient's physiological status and clear, concise communication with the anesthesia provider are vital throughout the procedure. In the event of a complication, the DAA must be able to respond promptly and appropriately according to established protocols and their scope of practice. This systematic approach, grounded in regulatory compliance and ethical practice, forms the bedrock of safe dental anesthesia assistance. Question 16. When evaluating the anatomical structures of the skull to ensure precise anesthetic delivery for dental procedures, which bony landmark is critical for the dental anesthesia assistant DAA to accurately identify when administering local anesthesia to the anterior superior alveolar nerve, and what is the most appropriate action if this landmark is not clearly discernible? Option A. The infraorbital foramen, and if not clearly discernible, the DAA should palpate the zygomatic bone and the nasal bone to triangulate its approximate location, then confirm with the supervising dentist before proceeding. Option B. The mandibular notch, and if not clearly discernible, the DAA should inject into the retromolar triangle. Option C. The greater palatine foramen, and if not clearly discernible, the DAA should administer a topical anesthetic to the entire palate. Option D. The mental foramen, and if not clearly discernible, the DAA should proceed with a more generalized injection in the mandibular region. The correct answer is A. The infraorbital foramen, and if not clearly discernible, the DAA should palpate the zygomatic bone and the nasal bone to triangulate its approximate location, then confirm with the supervising dentist before proceeding. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of anatomical landmarks during a procedure, which could lead to patient harm. The dental anesthesia assistant DAA must rely on their understanding of skull anatomy to ensure accurate needle placement and avoid vital structures. The ethical imperative is to prioritize patient safety and provide care within the scope of practice, adhering to established protocols and the dentist's instructions. Correct approach analysis. The correct approach involves the DAA accurately identifying the anatomical landmarks of the mandible and maxilla, specifically the infraorbital foramen, based on their knowledge of the skull's bony structures. This ensures the anesthetic is delivered to the correct target area, minimizing the risk of complications such as nerve damage or inadequate anesthesia. This aligns with the DAA's responsibility to assist the dentist in administering anesthesia safely and effectively, adhering to the principles of patient care and professional competence as outlined in dental assisting regulations. Incorrect approach is analysis. One incorrect approach would be to proceed with anesthetic injection without precise identification of the infraorbital foramen, relying solely on a general approximation of the area. This demonstrates a failure to adhere to the fundamental principles of anatomical accuracy required for safe injection techniques, potentially leading to injection into surrounding soft tissues or even bone, causing patient discomfort or injury. This violates the ethical duty to provide competent care and the regulatory requirement to perform procedures with precision. Another incorrect approach would be to administer the anesthetic based on the patient's subjective report of pain location, rather than objective anatomical landmarks. While patient comfort is important, relying solely on subjective feedback for injection site determination bypasses the critical anatomical knowledge necessary for safe and effective anesthesia. This could result in misplaced injections, inadequate pain control, and potential damage to nerves or blood vessels, representing a significant breach of professional responsibility and patient safety protocols. A further incorrect approach would be to delegate the identification of the infraorbital foramen to an untrained individual or to assume the dentist has definitively marked the site without personal verification of the anatomical landmark. The DAA has a specific role in assisting with anesthesia, which includes understanding and verifying critical anatomical references. Failure to do so, or to rely on others without confirmation, constitutes a dereliction of duty and a potential violation of the scope of practice, jeopardizing patient safety. Professional reasoning. Professionals should employ a systematic approach to patient care, beginning with a thorough understanding of the relevant anatomy. When administering anesthesia, this involves not only knowing the general area, but also precisely identifying bony landmarks that guide injection placement. A decision-making process should include 1. Confirming the anatomical knowledge of the target area. 2. Visually and palpably identifying the specific bony landmark, e.g., infraorbital foramen. 3. Cross-referencing with the dentist's instructions and any markings. And 4. Proceeding with the procedure only when confident in the accuracy of the landmark identification. This ensures patient safety and adherence to professional standards. Question 17. Cost-benefit analysis shows that while ester-based local anesthetics like Procaine are less expensive to procure, a patient presents with a documented history of severe allergic reactions to numbing injections in the past. Given this information, which approach best balances cost-effectiveness with patient safety and regulatory compliance for the dental anesthesia assistant? Option A. Administering a topical anesthetic only, as it avoids the systemic risks associated with injectable anesthetics, even if pain control is suboptimal. Option B. Administering an amide-based local anesthetic such as lidocaine or mepivacaine, as these agents have a significantly lower risk of allergic reactions compared to esters. Option C. Administering Procaine, as it is the most cost-effective option and the patient's previous reaction might have been due to other factors. Option D. Administering an ester-based anesthetic with a lower PABA content, as this may reduce the likelihood of an allergic response. The correct answer is B. Administering an amide-based local anesthetic such as lidocaine or mepivacaine, as these agents have a significantly lower risk of allergic reactions compared to esters. Explanation. This scenario is professionally challenging because the dental anesthesia assistant DAA must balance the immediate need for effective pain management with the potential for adverse reactions, particularly in patients with specific sensitivities or medical histories. The DAA's role is to support the dentist, and this includes understanding the properties of different local anesthetics to anticipate and mitigate risks. Careful judgment is required to select the most appropriate anesthetic based on patient factors and the procedure, ensuring patient safety and optimal outcomes. The correct approach represents best professional practice because it prioritizes patient safety by considering the known allergenic potential of ester-based anesthetics. Ester anesthetics like Procaine are metabolized into PABA, which is a common allergen. Amide anesthetics such as lidocaine, mepivacaine, bupivacaine, and articaine are generally less allergenic and are metabolized differently, making them a safer choice for patients with a history of allergic reactions to anesthetics. This aligns with the fundamental ethical principle of do no harm and the regulatory requirement for DAAs to operate within their scope of practice, which includes understanding contraindications and precautions for medications used in dental anesthesia. An incorrect approach would be to administer an ester-based anesthetic without a thorough patient history, or to dismiss a patient's reported allergy to a specific anesthetic class without further investigation. This demonstrates a failure to adhere to standard patient assessment protocols and a disregard for potential severe allergic reactions, which could lead to anaphylaxis. Such an action would violate ethical obligations to provide competent care and could contraindicate regulatory compliance regarding patient safety and informed consent. Another incorrect approach would be to administer an amide anesthetic without considering the specific properties of each amide. For instance, while generally safer than esters, some amide anesthetics have different durations of action or potential side effects that might be less suitable for certain patients or procedures. Failing to differentiate between amide agents and their specific characteristics, such as the vasoconstrictor content or potency, shows a lack of detailed knowledge required for optimal anesthetic selection and patient care. This could lead to suboptimal pain control or increased risk of adverse effects, falling short of the standard of care. The professional reasoning process for similar situations should involve a systematic approach. 1. Thorough patient history. Always obtain and review a comprehensive medical and dental history, paying close attention to any reported allergies, previous adverse reactions to anesthetics, and relevant medical conditions. 2. Anesthetic selection based on patient factors. Consider the patient's age, weight, medical status, and any known sensitivities when choosing a local anesthetic. 3. Understanding drug properties. Possess a working knowledge of the different classes of local anesthetics, esters, and amides, their metabolism, potential side effects, and allergenic potential. 4. Consultation and collaboration. If unsure about the best anesthetic choice or if a patient has complex medical needs, consult with the supervising dentist or other healthcare professionals. 5. Documentation. Accurately document the anesthetic used, the dosage, and any patient responses or adverse events. Question 18. Operational review demonstrates that a patient scheduled for dental anesthesia has reported taking several over-the-counter (OC) medications for mild pain and a prescription for a common antibiotic. The dental anesthesia assistant (DAA) is aware that certain OTC pain relievers can potentiate the effects of sedative medications, and some antibiotics can alter the metabolism of anesthetic agents. Which of the following actions best reflects the DAA's professional responsibility in this situation? Option A. Inform the patient that their current medications are not a concern and that the anesthetic procedure can proceed without any modifications. Option B. Consult a comprehensive drug interaction database for the reported medications and the planned anesthetic agents, and then communicate any identified significant interactions to the supervising dentist for their review and decision-making. Option C. Advise the patient to stop taking all their current medications, both OTC and prescription, immediately before the appointment to avoid any potential interactions. Option D. Proceed with the anesthetic plan as scheduled, assuming that common OTC medications and antibiotics do not pose a significant risk to the planned anesthesia. The correct answer is B. Consult a comprehensive drug interaction database for the reported medications and the planned anesthetic agents, and then communicate any identified significant interactions to the supervising dentist for their review and decision-making. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental anesthesia assistant (DAA) to exercise critical judgment in a situation involving potential patient harm due to drug interactions. The DAA is not a prescriber, but plays a vital role in patient safety by identifying and flagging potential risks. The challenge lies in recognizing subtle but significant interactions that could compromise the patient's well-being during anesthesia, necessitating a proactive and informed response. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety through diligent information gathering and clear communication. The DAA's responsibility is to identify potential drug interactions based on the patient's reported medications and the planned anesthetic agents. By consulting reliable, up-to-date drug interaction databases and promptly informing the supervising dentist, the DAA fulfills their ethical and regulatory obligation to contribute to a safe anesthetic environment. This proactive step allows the dentist to make informed decisions regarding medication adjustments or alternative anesthetic plans, directly preventing potential adverse events. This aligns with the general principles of patient care and the specific responsibilities outlined for DAAs in ensuring patient safety. Incorrect approaches analysis. One incorrect approach involves assuming that common over-the-counter medications pose no significant risk and proceeding with the anesthetic plan without further investigation. This fails to acknowledge that even seemingly benign medications can have serious interactions with anesthetic agents, leading to unpredictable and dangerous outcomes. This approach violates the DAA's duty of care and the principle of do no harm. Another incorrect approach is to dismiss the patient's reported medications as irrelevant to the anesthetic procedure without proper verification. This demonstrates a lack of understanding of pharmacodynamics and pharmacokinetics, where a wide range of substances can influence how anesthetic drugs are metabolized, distributed, or exert their effects. This oversight can lead to inadequate anesthesia, prolonged recovery, or severe adverse reactions, representing a significant breach of professional responsibility. A third incorrect approach is to independently advise the patient to discontinue their prescribed medications without consulting the supervising dentist. This oversteps the DAA's scope of practice, as only a licensed prescriber can alter a patient's medication regimen. Such an action could lead to serious health consequences for the patient due to the abrupt cessation of necessary treatment, and it undermines the authority and responsibility of the dentist. Professional reasoning. Professionals should adopt a systematic approach to patient assessment. This includes a thorough review of the patient's medical history, current medications, prescription, over-the-counter, and herbal supplements, and allergies. When potential drug interactions are identified, the professional should consult authoritative drug interaction resources. Crucially, all findings and concerns must be communicated clearly and promptly to the supervising dentist, who will then make the final clinical decision. This collaborative approach ensures that patient safety is paramount and that all potential risks are adequately addressed within the scope of practice. Question 19. Risk assessment procedures indicate that during a prolonged dental anesthesia procedure requiring specific head and neck positioning, there is a potential for undue stress on the muscles of mastication. Considering the primary functions of the masseter, temporalis, medial pterygoid, and lateral pterygoid muscles, what proactive measures should the dental anesthesia assistant prioritize to ensure patient safety and comfort related to these muscles? Option A. Ensuring adequate sedation levels to induce complete muscle relaxation, disregarding specific anatomical considerations of mastication. Option B. Adjusting patient head and neck positioning to minimize strain on the temporomandibular joint and associated musculature, particularly considering the role of the lateral pterygoid in jaw movement. Option C. Focusing solely on monitoring the patient's respiratory rate and depth, assuming masticatory muscles will not be significantly impacted. Option D. Applying a chin strap to stabilize the mandible throughout the procedure, without specific consideration for individual muscle function. The correct answer is B. Adjusting patient head and neck positioning to minimize strain on the temporomandibular joint and associated musculature, particularly considering the role of the lateral pterygoid in jaw movement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental anesthesia assistant DAA to apply theoretical knowledge of the muscles of mastication to a practical clinical situation involving patient positioning and potential complications during dental anesthesia. The DAA must recognize how specific muscle actions can impact airway management and patient safety, necessitating a proactive approach to prevent adverse events. The challenge lies in anticipating potential issues arising from altered muscle function or positioning and implementing preventative measures. Correct approach analysis. The correct approach involves understanding that the lateral pterygoid muscle plays a crucial role in opening the jaw and protruding the mandible. During certain anesthetic procedures, especially those involving airway manipulation or prolonged procedures, improper head and neck positioning can lead to excessive strain or abnormal function of the lateral pterygoid. Recognizing this, the DAA should ensure the patient's head and neck are positioned to minimize stress on the temporomandibular joint and associated musculature, thereby preventing potential temporomandibular joint dysfunction or muscle strain. This aligns with the DAA's responsibility to assist in maintaining patient comfort and safety throughout the procedure, which includes anticipating and mitigating potential physical discomfort or injury. This proactive stance is a cornerstone of best professional practice, emphasizing patient well-being and adherence to the principles of safe dental anesthesia. Incorrect approach is analysis. One incorrect approach would be to focus solely on the masseter and temporalis muscles, as these are primarily involved in closing the jaw and elevating the mandible. While important for mastication, their direct role in positioning-related complications during anesthesia is less pronounced than that of the lateral pterygoid. Overlooking the lateral pterygoid's function in jaw opening and protrusion could lead to inadequate preventative measures for potential joint strain or discomfort. Another incorrect approach would be to disregard the muscles of mastication entirely and focus only on general patient comfort. While general comfort is important, it is insufficient without understanding the specific anatomical structures and their potential vulnerabilities during anesthesia. This approach lacks the detailed, targeted assessment required for optimal patient care and safety. A further incorrect approach would be to assume that muscle function is unaffected by anesthetic agents or patient positioning. This assumption is dangerous as anesthetic agents can cause muscle relaxation, and improper positioning can place undue stress on these muscles, leading to adverse outcomes. This demonstrates a failure to apply critical thinking and a lack of understanding of the interplay between anesthesia, anatomy, and patient positioning. Professional reasoning. Professionals should employ a systematic approach to patient assessment and care. This involves 1. Understanding the relevant anatomy and physiology, including the function of key muscle groups like those of mastication. 2. Anticipating potential complications based on the planned procedure, anesthetic agents, and patient positioning. 3. Implementing preventative measures to mitigate identified risks. 4. Continuously monitoring the patient for any signs of distress or adverse events. 5. Documenting all assessments and interventions. In this context, the DAA must integrate knowledge of the muscles of mastication with the practicalities of anesthetic administration and patient positioning to ensure the highest standard of care. Question 20. The monitoring system demonstrates that a dental anesthesia assistant's basic life support (BLS) certification has expired, yet the assistant is scheduled to assist in a dental anesthesia procedure later today. Which course of action best upholds professional standards and regulatory compliance? Option A. Immediately inform the supervising dentist of the expired certification and refrain from assisting in any anesthesia procedures until the BLS certification is renewed. Option B. Request an immediate temporary waiver for BLS certification from the dental board to continue assisting in the procedure. Option C. Delegate the responsibility of verifying BLS certification to another team member and continue with the scheduled duties. Option D. Proceed with assisting in the anesthesia procedure as scheduled, with the intention of renewing the BLS certification immediately after the appointment. Correct answer is A. Immediately inform the supervising dentist of the expired certification and refrain from assisting in any anesthesia procedures until the BLS certification is renewed. Explanation. This scenario is professionally challenging because it requires immediate and decisive action based on a critical patient safety issue that directly impacts the ability to provide care. The dental anesthesia assistant DAA must prioritize patient well-being and adherence to established protocols over administrative convenience or personal convenience. The core of the challenge lies in recognizing that an expired certification directly compromises the DAA's legal and ethical standing to assist in anesthesia procedures, as BLS certification is a fundamental requirement for competency and patient safety in this role. The correct approach represents best professional practice because it directly addresses the immediate safety risk and ensures compliance with regulatory requirements. Maintaining current BLS certification is not merely a procedural step. It is a critical component of the DAA's scope of practice and a legal mandate to ensure they possess the necessary skills to respond to medical emergencies during anesthesia. By proactively seeking renewal and not performing duties without valid certification, the DAA upholds their professional responsibility to the patient and the dental practice, preventing potential harm and legal repercussions. This aligns with the overarching principle of patient safety and the regulatory framework that governs dental anesthesia assistants. An incorrect approach that involves continuing to assist in anesthesia procedures while the BLS certification is expired represents a significant regulatory and ethical failure. This action violates the explicit requirements of the governing body for dental anesthesia assistants, which mandates current BLS certification for practice. Ethically, it breaches the duty of care owed to the patient, as the DAA may not possess the up-to-date skills to manage life-threatening emergencies. Furthermore, it exposes the dental practice to liability and potential disciplinary action from regulatory authorities. Another incorrect approach, such as delaying the renewal process due to other perceived priorities, also fails to uphold professional standards. While other tasks may be important, patient safety and regulatory compliance related to essential life support skills must always take precedence. This delay demonstrates a lapse in professional judgment and a disregard for the critical nature of BLS competency. Professional decision-making in such situations should follow a clear hierarchy of priorities. First and foremost is patient safety, which is directly linked to regulatory compliance. Any situation that compromises either necessitates immediate action. The DAA should recognize that expired certifications render them unqualified to perform certain duties. The decision-making process should involve 1. Identifying the critical requirement, current BLS certification. 2. Assessing the impact of noncompliance, inability to legally and ethically assist in anesthesia. 3. Taking immediate corrective action, initiating renewal process and ceasing duties requiring certification until renewed. 4. Communicating the situation to the supervising dentist to ensure appropriate adjustments to patient care are made. This systematic approach ensures that patient safety is paramount and regulatory obligations are met without compromise.